Here are some tips for dealing with anxiety or even potentially post-traumatic stress disorder after breast cancer treatment is done. After you've finished your breast cancer treatment, it is actually very typical to continue to feel anxiety each time there's a checkup, a follow-up scan, an anniversary of the diagnosis. And that is not unusual. And sometimes it fades, not as much as you would want it to over time. If you continue to feel a high amount of anxiety, then you should think about seeing a mental health professional. It either may be generalized anxiety or it could be post-traumatic stress disorder. PTSD is something that happens to people, you hear about it in war veterans or people who've had a terrible trauma happen to them, but really it happens post a cancer diagnosis often enough, like 1 out of 10. So if you find yourself having flashbacks to the diagnosis, to the treatments, if you find that it's interrupting your sleep, if you're thinking about it often, if you feel easily startled and distressed by something that reminds you of it, and then if you're avoiding things that have to do with the cancer diagnosis, going to the hospital, going to follow-up care, you may have PTSD. It's important to see a mental health professional because there are treatments available for both of these things. They can make a huge difference, and it is important to be able to have your follow-up care.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.